Hello, my name is Linthoi Akoijam, and welcome to my LifePage. I am going to talk about clinical psychology today. Before talking about clinical psychology, let me talk a little bit about myself. I completed my graduation and my master's in psychology from the University of Delhi in India, and trained at, completed my MPhil in clinical psychology and completed my PhD in clinical psychology from the National Institute of Mental Health and Neurosciences, which is also known as NIMHANS in Bangalore. After that, I went to work in Australia as a clinical psychologist. I moved on to the United Kingdom and worked as a clinical psychologist there. Whilst working as a clinical psychologist in the United Kingdom, I had this opportunity to, it is a branch of specialization in psychology, which looks at two aspects. One is the treatment and intervention aspect, and one is the preventative intervention. And the treatment and intervention aspect is basically with the idea of alleviating distress in human beings. For example, people who might have conditions like depression, anxiety, schizophrenia, substance use problems like drug addiction, alcohol dependence or addiction. While doing graduation in clinical psychology, one learns the general psychology. So it's very important that we need to have the knowledge of what what psychology is all about. So in general psychology, you would cover things like learning, for example, or topics such as motivation, thinking, emotions. So one gets to know the theoretical aspects of these topics, and have a better understanding of these topics, which are going to be helpful in doing clinical psychology. First and foremost thing is, I think we need to be, as a practitioner, psychologist, clinical psychologist, we need to be quite reflective in our thinking, because obviously the kind of work that we're doing involves a lot of working with the human emotions and the behavior and the thinking in a person. Therefore, there's a lot of let's say, emotions sometimes evoked in us, and which might impact in the way of in the interaction between a psychologist and a client. Therefore, as one of the most positive thing that I find in clinical psychology as a clinical psychologist is the learning never stops, and it interacting with different client population gives a very rich understanding, a deeper knowledge, a deep understanding of the human behavior and human emotions. So that gives me intrigued, that is quite intriguing, and that gives me intrigued. The first being, I would say, there are professional issues such as competence, maintaining the difference between a personal boundary and a professional boundary, and confidentiality issues. Competence being, I think, especially in India, people claim to be clinical psychologists, but I think what we must keep in mind is when we say who a clinical psychologist is, a clinical psychologist should be a person who has undergone a supervised clinical training. Now, just having the theoretical knowledge, although it's very important, is not adequate enough for one to be called a clinical psychologist. One's got to have this. And so I start my day by about 9:30 down in the clinic, preparing for the day ahead, really. So if there are phone calls to be made, emails to be replied, or appointments to be confirmed, sit down and go through that with the team. Then I start, seeing clients from about, let's say, 10 o'clock. Before seeing my clients, I generally prepare ahead in advance in terms of what we've spoken about in the previous sessions, and make some notes for myself. See the client for a duration of about lasting between 45 minutes to an hour, after which I sit down and spend a little bit of time doing my own reflection on the sessions that have occurred, which is about, another 15 minutes. So the entire clock, although it's a bit, one of the other challenge of having your own private practice is, there is no like 9 to 5 job. Sometimes it can extend up to about 6 o'clock, but I try not to see clients after about 6 o'clock because, like I mentioned, I think it's important to spend some time on self-care. So yeah, that's how my typical day looks like. I hope I've given you a very balanced view of what clinical psychology is, and I wish you all the best in making a very informed choice in terms of what you would like to do and how you would like to contribute to the society. Thank you.